Hello again, this is Dr. Paul Searby from ProDentures, and I'm going to answer a couple more questions we get from online website visitors. Haven't yet chosen a dentist yet, but I have a lot of questions always, and I can't answer them all online, but I certainly can do this, which is answer a few of the more common ones. This one's about toothaches. My husband has an abscessed tooth, but doesn't know where to go to get it fixed. He hated his last lady dentist. What can I do? Is there anything he can put on it? Well, no, there really isn't anything you can put on it. When a tooth gets abscessed, the germs have gotten into the tooth and down through the canal system. It's hollow. It's kind of like the roots are kind of like a pencil, and it gets down into the bone and gets through the bone to the soft tissue, and then you got a swollen face, and it's really a rather sick emergency thing. Although you can tough it out, a lot of people do. They don't do anything, and your body accepts it, and it becomes a hole in abscess, chronic abscess, instead of an acute abscess, which is usually a swollen face, and it's rather dangerous. Neither of them are good, and neither of them are. It's likely that teeth will be saved. Root canal can fix some and save some, but one of the choices is to get it out. Another choice is to ignore it, which is not a good choice. If you get it out, you'll have to either have to replace it, or you have a choice to replace it, and there are ways to do that too. Fix it, remove it, or ignore it. Those are your three choices. And getting it out is probably the best one. First step would be antibiotics, an exam, an x-ray, which we do for free, just because it's hard enough to go to the dentist. How about we just make the first step easy? And take a look, take an x-ray, free x-ray, and find out, yeah, this is the tooth or teeth that are problematic. And usually when I see a new patient, the question is, all right, what are we going to do for you? And it usually starts with, get out the teeth that got to come out. Fix up the keeper teeth that we can, and hopefully they don't have to come out. I would prefer that they don't all come out. Partial dentures can fill in the gaps just as, better than full dentures. If you have no teeth and you need full dentures, well, fine. A good set of full dentures is good. It can be very nice. It can't be great. The lower dentures are tough, which leads to the implant problem. How about we leave some teeth behind? So if you have bad teeth, the first step is take a look and see which ones are salvageable, which ones got to go to get you healthy. And the first step is get them out, and then proceed down the list. Ideally, it's get out the bad ones, fix up the ones that are fixable in some simple fashion. If it's too expensive, they go away too. And eventually, we have nothing but healthy teeth and gaps that can be filled with partial dentures, or ideally crown and bridge sometimes. Implants are useful too, but it's not the be-all end-all that the younger dentists are trying to make it. So hopefully I've helped here with the question here. If you have an abscess, basically you need to see me. You need to see someone. Get some antibiotics, not the emergency room. They're not really set up for that. It's just too expensive. You can get antibiotics, but you need to be seen by a dentist, obviously somebody who's good at taking out teeth, which at this point in my life includes me. So if you'd like, I can take a look for free and get out whatever teeth need to be taken out. It happens to be one of my skills, which is an odd thing to say, but that's how I am. So hopefully I can help you here. All right, I'll do another question in a minute. See ya.